Hi, my name is Jacob and today I'll be delivering a short presentation showcasing my exercise prescription skills. The topics that will be covered during this presentation include the introduction of a mock client, various pre-screening tools used to gather relevant medical history, and notes gathered during the initial consultation. Furthermore, a personalized needs analysis and action plan has been developed and is supported through the use of SMART goals. I will finish off the presentation with a summary slide. The client, who will be referred to as K, is a 19-year-old female who, based upon her height of 169 centimeters and weight of 52 kilograms, falls under the BMI classification of underweight with mild thinness, according to the World Health Organization Global Database on Body Mass Index. Blood pressure measurements were collected and were classified as normal according to the Heart Foundation. No current medical conditions were identified, although further questioning revealed the client sustained a patellar dislocation in 2012. Adult pre-exercise screening tools such as the PARQ, Fantastic Lifestyle Checklist, and ESSA pre-screening tool were utilized as a risk assessment strategy. No risks were identified during the screening. An initial consultation session was undertaken where background information was collected, providing insight into the client's current lifestyle. Kay currently studies full-time while maintaining part-time employment as a retail worker. Kay participates in weekly recreational volleyball games, which she describes as competitive. Current weekly activities amounted to 120 minutes of vigorous exercise conducted during these volleyball games, with the remainder of 240 minutes of moderate activity and 440 minutes of low-intensity physical activity coming from her occupation as a retail worker/student. And from activities of daily living. From a health perspective, Kay seeks to alter her body composition safely and effectively to produce gains in fat-free mass. Vertical jump height was identified as an important parameter to the client in relation to her performance on the court. To satisfy Kay's behavioral goal, a structured training program is required to alleviate the time constraints of a busy lifestyle. A needs analysis and action plan has been developed to support Kay in her development of optimal health and performance. From the information that has been extrapolated during the consultation phase, it has become apparent that a busy lifestyle and lack of structure is acting as a constraint on the client. Through an improvement of organizational skills and use of effective time management tools such as weekly planners, timetables, and calendars, it will be possible to implement a structured resistance training program. The ACSM's position stand on muscular fitness recommends 2 to 3 sessions of weekly resistance training. According to Deschênes and Kramer, the client can expect benefits to overall health and performance, such as improvements in body composition, musculoskeletal adaptations, neurologic adaptations, and metabolic adaptations. Furthermore, a study conducted by Wong and colleagues demonstrated the positive effect of muscle hypertrophy on patellar stabilization. Moving on to the performance side of things, Gonzalez and colleagues have described volleyball as a high-intensity, intermittent sport which places importance on both health and skill-related components of fitness, including power, muscular strength and endurance, agility, and speed. Through the implementation of 3 weekly 60-minute resistance training sessions focusing on multi-joint movements, we hope to elicit changes in body composition, that is, an improvement in fat-free mass, improvements in muscular strength, endurance, and power. A combination of sport-specific jumping that the client already participates in during volleyball training, coupled with resistance training, will produce increases in vertical jump, according to Volsky and colleagues. Through implementation of the new program, we hope to stabilize the knee joint to reduce the likelihood of recurring injury. When considering exercise prescription, we commonly look at physiology to inform our practice. A greater emphasis needs to be placed on psychological and biomechanical factors of a client to increase the adherence of our programs. A SMART goal system has been used to support the needs analysis in that it accounts for variables such as the client's prior knowledge of resistance training and nutrition, her economic situation, time constraints, and even includes possible evaluation methods. A realistic time frame has been included to guide the client in her current goals. In summary, a client has undergone various pre-screening and consultation processes. 3 goals were identified, including a behavior goal, a health goal, and a performance goal. In response to these goals, an action plan was developed which takes into account the client's current lifestyle and time constraints. The action plan requires the development of better time management skills to implement 3 hourly resistance training sessions weekly in order for all goals to be met. Thank you for listening.